Hello, my name is Marion and I'm a member of the Patient and Public Involvement Group for the Sea Change Project. When my mother was diagnosed with cancer, I supported her as best I could, feeling helpless at times but fighting to ensure she got whatever she needed to help her. The experience opened my eyes and I watched as we went through each stage together, waiting for the diagnosis, the appointments for chemo, for treatment in the specialist unit, calling the London ambulance service when we needed them, organising visits from the wonderful team of district nurses, organising support and the equipment that's available to help someone stay in their home, and liaising with the staff in the unit towards the end of her life. And I saw more than one person having to be there alone. Can you imagine having to go through this treatment on your own? It made me aware how difficult this is for anyone, whatever age or whatever the diagnosis. I saw that not everyone had the help and support of a close family member or loved one whilst going through this, and it became important to raise this issue with the Sea Change Project, to ask how are they looking into this aspect of care at end of life, how a single person manages their treatment and or palliative care without the support from someone else.
Marion raises an excellent question, and we were keen to hear from the voices of patients who navigate their health journeys alone. As part of the Sea Change Project, we are conducting interviews with patients who move between different care settings. We're trying to make sure we represent the voices of patients who have someone to care for them, but also patients who are alone. We're beginning to see differences both in the psychological realm and in the practical. For instance, when patients are moving between different care settings, those with a carer or family member can sometimes get a lift in a car, whilst those alone are reliant on public or hospital transports, which often isn't as flexible or reliable.
There is more discussion and awareness of loneliness, more people living alone. How does this affect the care they receive when they're dependent on others for their treatment, or the logistics needed to ensure they get the support in their own home? Can patients manage this on their own, and are there support systems to help them?
As Marion highlighted, it's been important for us on the project to understand the key demographics of our participants. When patients first sign up to the study, we ask them personal details, some of which ask about their living situation, whether they live alone or not, and whether they have a carer. When we start to analyze our data, we can explore how living alone may affect people's health outcomes, their experiences, and the type of care and support they receive. Thank you, Marion, and other members of our Patient and Public Involvement Group for focusing our attention on this important issue.